Magnetic resonance imaging is a truly fascinating imaging technology. It is a non-invasive technique that allows for unique and detailed visualizations of the human body, without exposing the patient to ionizing radiation. However, it is important to note that if proper safety protocols and regulations are not strictly observed, there is a significant risk of potential danger and accidents occurring. As such, comprehensive safety training for all personnel entering the MRI environment is an absolute necessity. Comprehensive safety training is essential to ensure the safety of both personnel and patients in the MRI environment. It is also crucial to inform and educate any other individuals who may come into contact with the MRI system, even if only for a short time. This includes rescue workers, firefighters, maintenance staff, and cleaning personnel. These people may be near the powerful magnet for a short time, but they still need to be made fully aware of the potential dangers and necessary precautions when working around the intense magnetic field. Furthermore, smoking and open flames are strictly prohibited anywhere within the facility housing the MRI magnet. The radiology department holds the primary responsibility for the safe operation of the MRI system, as well as providing comprehensive safety training for all personnel who may enter the MRI environment. This brief presentation aims to give an overview of the essential safety precautions that must be observed when using a magnetic resonance imaging system. There are three sources of risks associated with MRI scan: the strong main magnet used to generate the magnetic field that forces protons in the body to align with that field. Switching gradient magnetic field used to produce the images. Radio frequency waves used to excite the protons in body. Superconducting magnets are the most commonly employed magnets in clinical imaging applications, as they are capable of generating higher magnetic field strengths. The magnet for this kind of MRI scanners is always on even if it is not used. In the event of an emergency, these superconductive electromagnets can be quickly shut off or quenched at any given time. The patient is positioned within a powerful, homogeneous static magnetic field generated by a cylindrical magnet. The static magnetic field of a typical 3 Tesla MRI magnet is approximately 60,000 times stronger than the Earth's natural magnetic field. Despite the huge strength of this static magnetic field used in MRI, it does not cause any lasting or permanent side effects on the patient. The same principle applies to alternating magnetic fields, gradient magnetic fields, when used correctly. The magnetic fields generated by MRI systems do not pose any issues. However, magnetic fields from MRI equipment can present substantial dangers if not handled properly. These magnetic fields exert an incredibly powerful attractive force on magnetic objects and materials. Once an object is drawn in by this magnetic force, it often becomes uncontrollable, rapidly accelerating towards the magnet and transforming into a dangerous projectile. It's important to remember that individuals with implanted medical devices can be adversely affected by the powerful magnetic fields present in the MRI environment. For instance, some pacemakers are not approved for use in the MRI examination room. This same restriction applies to metal implants or other objects within the patient's body, such as prostheses, that are not deemed MRI safe. Before entering the MRI examination room, it is crucial to ensure you do not have any metallic objects on your person or inside your body. There are three main classifications of objects in relation to the MRI examination room environment. MR safe: these are objects that pose no known hazards in any MRI setting. MR safe items include non-conducting, non-magnetic materials such as plastic. An object may be deemed MR safe based on scientifically grounded information, rather than solely relying on test data. MR conditional: the safety of these objects depends on the specific MRI environment. More testing and evaluation is required to determine their compatibility. MR unsafe: these are objects that are unsafe to bring into any MRI environment, as they present serious hazards. MR conditional objects are those that have been shown to pose no known hazards in a specific MRI environment, as long as certain conditions of use are met. The field conditions that define the specified MRI environment include magnetic field strength, spatial gradient of the magnetic field, time rate of change of the magnetic field, radio frequency fields, specific absorption rate. In addition to these environmental factors, there may be other specific configurations or requirements for the MR conditional item itself that must be adhered to in order to ensure safety within the MRI setting. MR unsafe objects are those that are known to pose hazards in any and all MRI environments. Examples of MR unsafe items include magnetic objects such as a pair of ferromagnetic scissors. It is of critical importance to only use equipment and items in the MRI examination room that are clearly labeled as either MR safe or MR conditional. Any scanner items that do not have an explicit MR safety label must be initially treated as MR unsafe, until their compatibility can be verified. The American College of Radiology has defined 4 safety zones within MRI facilities, numbered 1 to 4. The zones correspond to the increasing exposure to the magnetic field, and, therefore, the increasing potential safety risks. These zones are designed to ensure the safety of patients, staff, visitors in the MRI environment. The controlled area for the magnetic field strength is established and defined around the MRI system's magnet. This controlled area must be clearly marked and designated. In a typical MRI system, the controlled area extends a few meters out from the center of the magnet. The main MRI safety zones are, Zone 1, this is the general public area, which is accessible to everyone. It is the area outside the MRI suite, where no special safety precautions are required. Zone 2, this is the restricted area, which is the interface between the general public area and the MR scanner room. Access to this zone is controlled, and it requires basic MRI safety screening. Zone 3, this is the highly restricted area, which includes the MRI scanner room and any areas where the magnetic field may be present. Access to this zone is strictly controlled, and it requires extensive MRI screening and training. Zone 4, this is the MRI scanner room itself, where the strongest magnetic fields are present. Access to this zone is the most restricted and requires the highest level of safety precautions. All of the safety precautions and guidelines regarding MR safe, MR conditional, and MR unsafe objects are important for both patients and healthcare staff working with the MRI system. Everyone within the MRI environment is exposed to the electromagnetic fields generated by the system. To prevent any surprises or risks during the MRI examination, each MRI facility should provide detailed information to patients about the procedure. This is crucial to identify any contraindications or potential issues that could arise for the patient due to their medical condition or implanted devices. Before entering the MRI scanning room, both patients and any accompanying persons must undergo a thorough screening process. This includes filling out a detailed questionnaire form prior to the MRI examination. The questionnaire is essential, as it contains important questions that must be clearly answered and explained by them. The completed questionnaire must be signed by both the patient and the medical personnel overseeing the patient's care. This fully completed questionnaire then becomes part of the patient's medical record. The physician cannot make a decision on whether to proceed with the MRI examination unless this comprehensive screening questionnaire has been entirely filled out. As of today, there is no conclusive scientific evidence that MRI examinations are entirely harmless for pregnant women. Additionally, MRI scanning has not been definitively established as a safe procedure for imaging fetuses and infants under the age of 2. Given these uncertainties, the responsible physician must carefully evaluate the potential benefits of performing an MRI examination compared to the benefits of utilizing other available imaging procedures. The physician must weigh the risks and make an informed decision on whether to proceed with the MRI for these patient populations. MRI examinations may be contraindicated, or not recommended, for patients with certain implanted devices or physical characteristics. Examples of such contraindications include patients with specific types of pacemakers, aneurysm clips, electronic stimulators, and other implanted systems. While permanent makeup and tattoos are not necessarily contraindications themselves, they should be documented prior to the MRI exam. Patients should be informed that tattoos may contain ingredients that can lead to imaging artifacts, skin irritation, or localized heating during the MRI procedure. The safety precautions regarding MRI contraindications also apply to other conductive materials, such as dental braces, body piercings, and jewelry. Before entering the MRI examination room, both patients and staff are required to remove a variety of objects. This includes all metal objects, cell phones, pagers, watches, jewelry, hearing aids, garments with metallic fasteners, hooks, wires or threads, as well as any metallic medication delivery devices, hair accessories like barrettes and wigs, and makeup or deodorants containing metal alloys. Patients should wear clothing made of natural fibers and free of any metal components before entering the MRI examination room. When positioning the patient, it is essential to ensure that all coils and cables are in proper working condition. Additionally, any devices used in the examination room must be compatible with the specific field strength of the MRI system being used, as devices suitable for a 1.5T system may not be appropriate for a 3T system. Defective RF coils can potentially cause localized burns, so proper separation between the patient and the magnet bore must always be maintained. Appropriate positioning devices should be used to ensure the safety and comfort of the patient. Care must be taken to ensure that the patient's clothing and any coils do not hang at the patient table. The patient should be positioned in a way that avoids the legs and hands touching or crossing, and the arms should not be interlaced, as this can create electrical current loops that may act as an antenna for the radio frequency energy, potentially leading to localized burns. In order to respond appropriately during an emergency situation, it is crucial to be able to identify the type of emergency that has occurred. For accidents involving the electrical equipment or a fire, the proper response is to press the emergency shutdown switch. This will disconnect the scanner electronics from the main power supply, but it will not shut down the strong magnetic field generated by the MRI scanner. If the motorized patient table movement has stopped working, you can use the emergency release mechanism to manually move the table. This allows you to safely extract the patient from the scanner in an emergency situation. In the event of an extreme emergency where there is a serious risk of harm or even death to the patient or staff, the immediate action required is to press the magnet stop switch. This will initiate a process called quenching of the magnet. When the magnet is quenched, the superconductivity in the electromagnet is deliberately broken down, causing the powerful magnetic field to dissipate rapidly, within around 20 seconds. This is an emergency shutdown procedure that removes the magnetic field as quickly as possible to mitigate the danger. This should only be activated in extreme emergency situations as it might permanently damage the scanner's magnet. When the magnet is quenched, the superconducting electromagnet loses its ability to maintain the strong magnetic field. This causes the stored helium coolant to rapidly escape through the quench pipe, making a loud noise in the process. In the event that the quench pipe fails, the helium can then enter the examination room itself. If this occurs, all personnel in the room should exit the area as soon as possible. Direct contact with the extremely cold liquids, gases, or surfaces, such as the pipes, during a quench can result in frostbite injuries. The sub-zero temperatures of the cryogenic materials pose a serious risk of damage to exposed skin. For safety reasons, it is crucial to take the recommended guidelines for MRI equipment operation and personnel very seriously. Regular maintenance of the MRI scanner and associated systems is essential. Comprehensive emergency plans should be created that clearly outline the specific actions and measures that patient, staff, and rescue workers should take in response to potential hazards and dangerous situations. Conducting regular emergency response drills and exercises with all relevant groups is recommended. This helps ensure everyone is prepared and knows how to properly react in the event of an actual emergency. Detailed documentation of any emergency incidents that do occur should be maintained. This documentation can help inform future emergency planning and training efforts. To ensure safety in emergency situations, it is essential to provide non-magnetic tools for use by cleaning staff and emergency response personnel. In the event of an emergency, it is critically important that the available non-magnetic rescue tools such as fire extinguisher are clearly identified and their locations are known. This allows emergency personnel to quickly access the appropriate equipment to safely respond to the situation without introducing additional magnetic hazards. Thank you for watching this brief MRI safety awareness video. If you have any query or if you require any further information, please contact Department of Radiology and Medical Imaging.